Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's dive right in. It's kind of wild, right? Millions of people, first thing in the morning, they're not reaching for coffee, they're looking at a number.
Yeah, a single number on their wrist or ring.
Exactly, like a readiness score or body battery or maybe strain. It comes from these fitness trackers we all seem to wear now.
And they're marketed as this super simple way to figure out how your body's doing, you know?
Which leads to the big question, the one we're tackling today. How much should you actually trust that number?
It's fascinating how they do it, though. They take all this really complex physiological stuff, heart rate, sleep quality, activity levels, and just crunch it down.
Into one score.
One score. It's designed to be appealing, obviously. Just a single digit telling you, like, go hard today or maybe take it easy.
Yeah, like a little cheat sheet for your body. But, well, with any cheat sheet, you got to wonder what's being left out, right? So for everyone listening, this whole world of wearable health scores, it can feel super helpful, or maybe just like more noise, more data overload, which is why for this deep dive, you brought us a great health news piece from April 2025, looking right at that trustworthiness issue.
Yeah, and also the scientific paper it drew from. That one's called Readiness, Recovery, and Strain, an evaluation of composite health scores in consumer wearables.
Published this year, too, in Translational Exercise Biomedicine.
Right. So we've got both the news take and the underlying research.
So the mission today, our goal for this deep dive is really to unpack these scores.
Get under the hood, yeah. Look at the science, or maybe the lack of science in some cases.
Figure out what they're really telling you.
And help you understand how to use this info without needing like a PhD to decode your watch every morning.
Okay, let's start with that scientific paper then. What were the researchers actually trying to do? What was the main goal?
Well, their core purpose was to systematically evaluate these composite health scores, the ones from the big names in wearables. They wanted to understand the methods behind them, what data actually goes into them, and, crucially, what scientific backing exists or doesn't exist for how they're calculated.
And how did they tackle that? Because these companies aren't exactly shouting their secret formulas from the rooftops, are they?
No, definitely not. That's a key point. So the researchers had to rely on publicly available information.
Like what kind of stuff?
Things like the company's own white papers, user manuals you can download, even just looking at the app interfaces, and any published research they could find related to these scores.
Right.
And from all that digging, they managed to identify 14 different composite scores.
14. Across how many companies?
10 major manufacturers.
Wow, okay. 14 scores, 10 companies. That alone tells you there's not much standardization happening.
Exactly. It's like everyone's inventing their own way to measure readiness or recovery.
So who were the companies? Can you list them and the scores they looked at?
Sure. They covered Fitbit, that's the daily readiness score. Garmin has 2, body battery and training readiness. Aura also has 2, readiness score and resilience. WOC has 3, strain, recovery, and stress monitor.
Okay.
Then Polar with nightly recharge, Samsung with their energy score, Sumto with body resources, Ultrahumans dynamic recovery, Coros with daily stress, and Withings with their health improvement score.
That's quite the collection. Different names, probably different calculations, even if they sound similar.
That's the issue.
So across all these, did the researchers find any common ground? Like what data points kept showing up again and again?
Yeah, there was definitely overlap, but also, like you said, variation. The most common inputs were heart rate variability. That was in 86% of the scores.
Okay, HRV, that makes sense.
Then resting heart rate in 79%. Physical activity and sleep duration were tied, both in 71% of the scores.
Like the big four almost. Heart function, movement, sleep. Makes intuitive sense.
Totally.
Were there other things they looked for? Less common metrics?
Yes. Several others popped up less frequently. Things like sleep quality metrics, like deep sleep, REM sleep stages, that was in about 57%. Also, body temperature, breathing rate, blood oxygen saturation. Those were used by some.
Anything more surprising?
Well, a few incorporated things like body morphology, so weight or body fat, blood pressure, and even ECG, electrocardiogram, heart rhythm data. But those were definitely less common.
Got it. So we have all these inputs. How are the wearables actually getting this data? What's the tech inside?
Primarily 2 main technologies. First is photoplethysmography, PPG.
Okay, Photoplethysmography.
Yeah, it's the tech that usually involves shining light onto your skin to measure blood flow changes. That's how they estimate heart rate variability, respiratory rate, even blood oxygen sometimes.
Yeah, the little flashing green light.
Exactly. And the second key tech is accelerometry.
Measuring movement.
Yeah, detects motion. Crucial for tracking physical activity, steps, and also for figuring out your sleep stages based on how much you move.
Okay, so PPG and accelerometry feeding data in. Now, the crucial bit, how does that raw data become the single score?
Yes.
Algorithms, right, the secret sauce.
And this is where it gets really murky. A huge finding from the study was just how different everything is.
Different how?
The time frames they use to collect data, how much weight they give to each metric, like, is sleep more important than activity? And the overall scoring methods, they're all proprietary.
Meaning secret.
Meaning totally secret. None of the manufacturers actually disclose their exact formulas. It's a black box.
Wow.
And maybe even more importantly, very few provided any solid peer-reviewed evidence or validation to show their scores are accurate or, clinically meaningful.
So basically, they're selling us a number based on a secret recipe with little proof it actually works as advertised.
That's a blunt way to put it. But yeah, the lack of transparency and validation is a major concern highlighted by the research. These scores are kind of operating on faith.
That lack of transparency feels like a huge red flag straight away.
Yeah.
You're making decisions based on a number you fundamentally don't understand.
Yeah.
Okay, let's pivot to the implications then. The news article did mention some potential upsides, right? What are the good points?
For sure. The main appeal, as the article notes, is that simplification. Boiling down complex data to a simple push or rest message is useful for some people. And tracking these signals over time can help you spot patterns. You might notice, oh, my resting heart rate is lower when I sleep 8 hours, or my HRV tanks after 2 glasses of wine.
Yeah, I've seen that myself.
Right. So it can help improve habits and understand how your body reacts to stress, training, lifestyle choices. That pattern recognition can be valuable.
Okay, so trend spotting, habit building. But the research pointed to some serious downsides, too.
Right.
Let's get into those pitfalls.
Absolutely. One big one is just sensor accuracy. Like we said, these are estimates.
Right.
They use optical sensors, motion tracking. It's not a direct medical measurement. Even small errors in measuring your heart rate or movement can get fed into the algorithm and potentially distort that final score.
So the foundation might be a bit shaky sometimes.
It could be. The score you see might not be a perfect reflection of your internal state because the input data itself isn't perfect.
And we keep coming back to this transparency issue. How does that lack of knowing the recipe really hurt us?
Well, if you don't know which inputs matter most or how they're combined, or if the score is even adjusted for your age, your fitness level, how can you really evaluate what that number means?
Yeah.
Is a readiness of 70 good for me? Or is it based on some generic profile? It's hard to know if it's truly personalized or meaningful without seeing the calculation. You're just trusting the company got it right.
The news piece also brought up double dipping. What do they mean by that?
Yeah, that's an interesting one. It's the idea that some algorithms might penalize you multiple times for linked issues.
For example,
Okay, say you sleep badly. That often leads to lower heart rate variability the next day, right? Both are signs of stress or poor recovery. But an algorithm might hit you for the poor sleep and hit you again for the resulting low HRV without recognizing they're connected.
So it makes things look worse than they are.
It could exaggerate the impact of that one bad night's sleep, like getting 2 penalties for the same foul. It makes the analysis seem detailed, but it might just be flagging the same underlying problem twice.
That does seem potentially misleading. And what about penalizing for past activity?
Right. Some scores seem to factor in yesterday's workout heavily, even if your body's key recovery markers like HRV and resting heart rate have bounced back to normal overnight.
So even if you feel recovered, the score says no.
Potentially, yeah. The algorithm might still be weighing yesterday's effort negatively, giving you a lower readiness score than your current physiological state might warrant. You feel great, but the watch says rest.
Okay, and the last point there was about personalized baselines. Sounds good in theory, right? Comparing you to you.
It does sound good. Acknowledging individual differences is smart.
But
the problem is there's zero standardization in how these baselines are calculated. One device might use 7 days of data, another 30 days. How do they handle outlier days, sick days, travel?
so my baseline on a Fitbit might be totally different from my baseline on a Garmin.
Completely different calculation methods. So comparing scores between devices is basically meaningless. And it even raises questions about how consistent and reliable your own baseline is on a single device over time.
Okay, lots of potential issues bubbling up. Let's dig deeper into the limitations the scientific paper itself really hammered home. Sensor accuracy we covered.
Yeah, that's fundamental. Estimation, not perfect measurement.
What else?
The biggest one, we keep saying it, but it's crucial, the proprietary algorithms, the black box nature.
Right.
That lack of transparency makes independent validation almost impossible. Researchers can't easily test if score A is truly better or more accurate than score B because they don't know exactly how either is calculated.
It blocks scientific scrutiny.
Completely. And it limits your understanding as a user. Plus, this ties into the huge inconsistencies in how they even measure the inputs.
You mean like measuring HRV or resting heart rate differently?
Exactly. The paper detailed this really well. It's kind of staggering, actually.
Give us some examples. How different can it be?
Okay, for heart rate variability. Cora suggests you manually take a reading at a set time. Fitbit uses data from your longest sleep block over 3 hours. Garmin averages it across your entire sleep using 5-minute chunks. Aura averages all the 5-minute samples during sleep. Polar uses a specific 4-hour window after you fall asleep.
Wow. That's wildly different, just for HRV.
Totally different methodologies. And it's similar for resting heart rate. Fitbit uses sleep or inactive periods. Garmin finds the lowest 30-minute average in 24 hours. Aura looks at averages and lows during sleep. Polar uses that same 4-hour sleep window. Samsung measures during inactivity but doesn't specify exactly how. Sun2 might use the lowest sleep value or let you enter it manually.
It's like they're all measuring slightly different things but calling it the same name.
Pretty much. Which makes comparing a good HRV reading or resting heart rate across brands almost impossible. They aren't speaking the same language physiologically.
And did the paper mention anything about when these measurements are most valid? Like HRV?
Yes, that's another key point. The established science linking heart rate variability to your parasympathetic nervous system, the rest and digest system, is strongest when you're truly at rest.
Like during sleep.
Exactly. When you're moving around during the day, lots of things, artifacts, can affect the HRV reading. So continuous stress monitoring based on daytime HRV might be, well, scientifically questionable without careful context and filtering. A low score might just mean you were active, not necessarily stressed.
Okay. And they also mentioned multicollinearity again. Can you break that down simply?
Yeah, it's basically that double-dipping idea again, but from a statistical perspective. It means some of the inputs used in the score are already related to each other.
That's a sleep and HRV example.
Precisely. Poor sleep often causes low HRV. If the algorithm treats them as two independent negative factors without accounting for their link, it can distort the final score, making your overall state seem worse than it might be. It's statistical redundancy.
Got it. So after all this analysis, what was the verdict from the experts? The news article had an opinion, and the researchers had their conclusions.
The expert quoted in the news article had some really grounded advice. Don't treat the daily score like it's a definitive medical diagnosis. It's not.
Use it as a guide, not a doctor.
Exactly. A guide, not a coach, doctor, or judge. Use it to notice trends in your data, but don't let it dictate everything if it doesn't match how you feel.
That feels like sensible advice. What about the researchers who wrote the paper? What was their final take?
They were quite cautious. They said, look, these composite scores are an interesting innovation, potentially useful, but their scientific validity, the transparency behind them, and whether they're actually useful in a clinical setting, all that remains pretty uncertain right now.
So more research needed.
Definitely. They called for work on standardizing how sensor data is combined, much more transparency around the algorithms, and studies evaluating these scores in diverse groups of people, not just, healthy young adults.
And more collaboration.
Yes, a big push for industry, researchers, and clinicians to actually work together to make these scores genuinely meaningful and validated health tools.
Did the paper mention other studies that tested these scores against real-world outcomes?
It did reference a couple of important ones that add context for listeners wondering how these scores stack up.
Like what?
One from 2023 looked at elite swimmers. It found only a moderate connection between HRV and certain metabolic markers, but not others. And importantly, WEP's recovery score didn't correlate with metabolic suppression in these athletes.
Interesting. What else?
That study also found that while higher self-reported stress linked to low HRV, the WOP recovery score itself didn't align with the swimmer's own feelings of stress or recovery.
So the score didn't match subjective feeling or some objective
In
markers.
that specific group, yeah.
Yeah.
And another study from 2025 on Dutch police officers found that the stress metrics from wearables didn't consistently line up with the officers' self-reported stress levels.
Did using the wearables help them manage stress?
It seemed to improve their awareness of stress a bit, but it didn't necessarily lead to big changes in their coping behaviors.
So these studies kind of reinforce the idea that the score isn't the whole picture.
Exactly. It might not perfectly capture your internal physiological state or how you actually feel or even drive behavior change consistently. It highlights that gap between the device's number and your lived experience.
And the experts were worried about the terminology too, right? Using words like readiness differently.
Yeah, that terminological ambiguity is a real problem. If Fitbit's readiness is calculated totally differently from Oro's readiness, using different inputs and weightings, it's confusing and potentially misleading for users who might assume they mean the same thing.
Okay, so wrapping this all together, what's the final message for someone listening right now, maybe glancing at their wrist? Should they just ignore that score?
No, not necessarily ignore it. As the news article suggested, there's still value there. Tracking your own core signals over time, seeing how your heart rate trends, how your sleep patterns shift, that can still teach you a lot.
Learning about your personal responses.
Yeah, understanding your personal baselines, even if imperfectly calculated, and noticing deviations. It helps you connect lifestyle choices to physiological responses. That self-knowledge is valuable.
So the advice is, be critical of the single score. Don't take it as gospel.
Precisely. Look beyond the single number if you can. Dig into the individual metrics. If your app shows them the raw HRV, the resting heart rate, the sleep stages, the trends over weeks or months.
And compare it to how you actually feel.
Absolutely. Ask yourself, does this data align with my subjective experience? What other factors, stress, diet, illness, might be influencing these numbers today? Your body's own signals are still incredibly important.
That makes sense. Use it as a data point, not the data point. Okay, so as we finish this deep dive on composite health scores, what's the final provocative thought you want to leave our listeners mulling over?
I guess it's this. Given everything we've discussed, the lack of transparency, the lack of standardization, the questions around validation, how can you, as an individual, best leverage the data you do get from your wearable to make genuinely informed decisions? And maybe more importantly, what questions should we all start asking the manufacturers and the researchers about the real proof behind these scores that are becoming so influential in how we think about our daily health and capacity?
Right. Moving from just passively receiving that number to actively questioning it and demanding better evidence.
Exactly. How do we ensure this technology truly serves our well-being based on solid science, not just clever marketing and secret algorithms?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.